If you bleed heavy for 3 days every single month, you extrapolate that over a year, that means 36 days a month. One solid month of your life, you feel like crap, you're changing tampons, and you say, why? I'm done having babies. But women live with this month after month, year after year after year. And if they say something to their doctor, which many women do not, but if they do say something to their doctor, oftentimes they will be offered a birth control pill option, or they'll be offered a hysterectomy. That's kind of it in a nutshell. But you have abnormal bleeding. It's a change from what you have had before. So you come to my office, we have this conversation, and I say, okay, let's get your labs and let's do an ultrasound. I do the ultrasound and I identify, do you have things in your uterus that are causing problems? Do you have fibroid tumors? Do you have a polyp inside your uterus? Things that we can correct without taking your uterus out. Assuming that your uterus is not too big, meaning greater than 12 centimeters, that would be consistent with a woman that's about 3 months pregnant. If your uterus is less than 12 weeks pregnant in size, then you're a candidate for what's called a uterine ablation. Now, uterine ablation, that word ablation means that we're destroying the inside cavity of the uterus. Now, think about it. There's 3 ways that you can destroy tissue. You can cut it out, you can burn it out, or you can freeze it out. So for much of my career, the great majority really until the past year, I either did a hysterectomy or I did uterine ablation using heat. And I used a device called a NovaSure, which is a T-shaped device. It goes inside your uterus, it opens up, and it sends intense heat, intense current in a rotational pattern like this. And hopefully we've burned enough of your uterus that your bleeding will decrease. Now, the interesting thing is because it goes like this, it may miss the corner of your uterus, either this side or this side. So if you look at the statistics with uterine ablation using heat, specifically NovaSure, 70% of women get better. That means 30% don't. And women, like we all do, oftentimes look at the pot or at the glass half empty versus half full, right? And so a woman will say, well, if it fails 30% of the time, I don't want to mess with that. I just go to hysterectomy. And then you have a surgeon that loves surgery and says, fine, we'll take your uterus out. And so that's kind of the mechanism of why there's so many hysterectomies done in the United States. We at Epiphany approach this a little bit differently. So number one, I've changed devices. This past year, I've switched to a device called Cerene, C-E-R-E-N-E. I like that name. You think about Cerene, you think, I kind of feel good. Well, it's kind of weird, but if you can stop bleeding and enjoy life, enjoy your husband, that's kind of a serene environment. What Cerene does is it uses intense cold. Now, I live down in South Alabama. What people don't know about, if you freeze a digit and get frostbite, but if you go up north and go to Canada, people fall off their snowmobiles and they're drunk, and all of a sudden they have frostbite of their feet or their hands and they lose body parts. Well, the same application occurs inside the uterus. We put this device up in your uterus. It's a balloon. It heats to it cools to minus 140 degrees Fahrenheit. Minus 140. That number is just mind-boggling. For 150 seconds, that ice cube sits inside your uterus. And then after 150 seconds, we stop the procedure, we let the ice cube melt, we pull the device out. 90% of women, this was an FDA-approved device. They provided more data to the FDA than the heating companies did, like NovaSure. They had more people in their studies, and they identified that 90% of women have improved bleeding all the way to 0 and improvement of their pain. Remember, oftentimes women, when they have pain, they have contraction of their uterus. It's called dysmenorrhea. So not only do they have goofy bleeding, clots, etc., they also have pain with their bleeding. And so dysmenorrhea rates, painful period rates, also decrease by 90%. We do office-based surgery at Epiphany. I love this. Now, I've been doing office-based surgery. I did this with Boyd OB-GYN, but we made it a staple in the way we approach women. So I'm heading to my office in Illinois tomorrow. I have 4 patients that I'm going to do an ablation on. We're going to use the Cerene device. They come into the office. They sign a consent form. They get an IV started. We give them IV sedation using a drug called propofol, which is very, very safe. That's the drug Michael Jackson used to go to sleep. Unfortunately, he took too much because he didn't have somebody managing his airway. So we have an anesthetist, which is called a CRNA. He manages the patient's airway. We do the procedure. Patient's asleep approximately 7 minutes. We wake the patient up. We take them to our recovery room. We manage them for anywhere from 15 to 30 minutes. Their husband picks them up right outside the back door and they go home. If they want to go to Waffle House 2 blocks away, they can. So they're here a total of about 1 hour and 15 minutes. Now you think about going to the hospital. In the best scenario for uterine ablation, you're there about 6 hours. So you can go to the hospital and spend 6 hours, plus it's at least 5 times more expensive than it would be here in the office. You're here an hour to an hour and 15 minutes. Your only restriction is you can't drive. We don't want you doing any type of hard work for 24 hours. After 24 hours, if you need to go to Alaska the next day, you can get on the airplane and go to Alaska. You would expect to have a lot of watery discharge because, again, you think about destruction of a tissue. It's like having a blister on your heel. That's called serous drainage. So when you get all that serous fluid and it collects in your uterus because your uterus is very inflamed because I've given 150 minus 140 degree temperature, you have all this inflammation, so you have all this watery discharge. And that watery discharge will be evident for about 7 to 14 days.
So I think women are loving having surgery in the office.
Absolutely.
I mean, going to the hospital is a terrible experience, and unless you want to get sick from something from the hospital, don't go, right?
Right, that's exactly right.
Just go if you're dying.